Hey Kiwi, do you ever wonder about how you would know or recognize if a fellow Panther is struggling with drugs or alcohol? Or how you could even help? We can help you with that. Did you know that the percentage of college students who report using stimulants, like Adderall, without a prescription ranges from 5 to 35%? Want to know more? Follow Kiwi. First stop, recognize. Some common worrisome things you may hear people say about their substance use may include, whatever, everyone does it, it's not that serious. I can stop whenever. I don't have a problem. I'm not hurting anyone else, I'm just taking the edge off. Recognize the common warning signs of when drugs or alcohol may be becoming a problem. Changes in personality, neglecting relationships with family or friend groups, mood swings or reacting uncharacteristically negatively or aggressively to those closest to them, more risk-taking tendencies, especially to get drugs, increased secrecy, like lying about the amount of substance they used or how frequently they're using, neglecting responsibilities / missing class or work, neglecting personal grooming, loss of interest in hobbies, sports, or other favorite activities, physical cues, red, glassy, or bloodshot eyes, or irregular pupil size, abrupt changes in weight, weight loss or weight gain, increased tolerance, needing to take more of the drug to get the desired effect, physical or mental discomfort while sober, such as sweating, trembling, or nausea, frequent slurred speech or unstable coordination, frequent nosebleeds or sniffly and running nose. Other signs: using substances to avoid or cope with difficult emotions, financial troubles due to substance use, potentially with money / valuables going missing, school or work performance suffering, attempts to cut down drinking / drugs are unsuccessful. Now that you know how to recognize common signs, time for the next stop. Next stop is respond. You know, what if someone needs help but you were drinking or using the drug too? I'm sure you wouldn't want to get yourself or your friend in trouble. If someone needs emergency medical assistance due to potential drug-related overdose, you will not be in trouble with the police when you call. Florida's Good Samaritan Act provides immunity from arrest, charge, or prosecution for simple drug possession when there is a potential overdose victim in need of medical assistance. This immunity is true for the potential victim as well as for those active bystanders making a good faith effort to get them help. Did you know that 1 in 4 college students report academic problems from drinking? Second stop, respond. When approaching a person who may be at risk for substance abuse, remember these tips when you respond. Be sure to talk to the person when they are sober. If they are under the influence during the discussion, they are less likely to be understanding and receptive. Touch base with the person privately, in a comfortable place. Convey care. For example, I really care about you and I've been worried about you lately. Express concern openly and honestly. Try to give specific examples that cause concern. For example, I notice you've been smoking more and skipping class. Or, I'm worried about how you've been isolating a lot more. Listen non-judgmentally. Listen to their feelings. Lean into the conversation with curiosity and care instead of criticism or accusations. Express validation, empathy, and understanding. Seems like things have been really hard for you lately. I hear what you're saying. I'm here if you want to tell me more about what you're feeling. Avoid lecturing. Lecturing negatives may backfire with increased likelihood of resistance, resentment, anger, or anxiety. Instead, try talking about the potential benefits of living sober. For example, imagine not having to be worried about getting kicked off the soccer team. I see how much that stresses you out about getting caught. Did you know that 20% of college students meet criteria for an alcohol use disorder, and that 1 in 10 college students engage in extreme binge drinking, more than 10 drinks in a row? After recognize and respond comes our last stop, refer. Know your local mental health recovery resources to refer at-risk students. Encourage the person to check the resources out. Offer help, support, and reassurance. Encourage your friend to make an appointment with the counseling center. Panthers for Recovery provides support for those recovering from addiction with AA meetings, NA meetings, all recovery support meetings, mentorship, as well as being a socially active sober student community. Panthers for Recovery also provides support for family and friends of those struggling with or recovering from addiction. For even more information and resources, check out these websites. And check out our page at go.fiu.edu/AOD.